The navel is what to the spine? Superior, anterior, posterior, or inferior? Anterior. The navel is on the front side of the body while the spine is on the back. The shoulder is what to the elbow? Distal, deep, superficial, or proximal? Proximal. The shoulder is closer to the point where the arm attaches to the trunk. The heel is on what surface of the foot? Plantar, anterior, posterior, or dorsal? Plantar. The heel makes contact with the ground on the bottom or plantar surface. The heel is posterior relative to the toes, but that's not what surface means. The kneecap is what to the knee joint? Superior, posterior, anterior, or inferior? Anterior. The patella is located on the front side of the knee joint. The ribs are what to the lungs? Superficial, medial, lateral, or deep? Superficial. The ribs are closer to the body surface than the lungs. The small intestine is positioned mostly where relative to the stomach? Anterior, inferior, posterior, or superior? Inferior. The small intestine begins at the stomach's exit and continues downward into the abdomen. The ribs are what to the diaphragm? Anterior, inferior, posterior, or superior? Superior. The ribs are located above the dome-shaped diaphragm muscle. The pinky finger is what to the index finger? Proximal, lateral, distal, or medial? Medial. In the anatomical position, the pinky is closer to the body's midline. The eyes are what to the ears? Anterior, inferior, superior, or posterior? Anterior. The eyes are located on the front of the head. The windpipe is what to the food pipe? Anterior, medial, lateral, or posterior? Anterior. The trachea is in front of the esophagus. The calf muscles are on the what side of the lower leg? Lateral, anterior, posterior, or medial? Posterior. Muscles like the gastrocnemius form the bulge at the back of the lower leg. The shin bone is on the what side of the lower leg? Medial, anterior, posterior, or lateral? Anterior. The tibia or shin bone is prominent on the front of the leg. The collarbone is what to the breastbone? Superior, inferior, lateral, or medial? Lateral. The clavicle extends outward from the sternum. In the anatomical position, the thumb points in which direction? Anterior, posterior, medial, or lateral? Lateral. The thumb points away from the body, to the side. The mouth is what to the chin? Inferior, superior, posterior, or anterior? Superior. The mouth is above the chin. The wrist is what to the hand? Deep, distal, proximal, or superficial? Proximal. The wrist is closer to the point where the arm attaches to the trunk than the hand is. In anatomy, proximal means closer to the trunk. The belly button is on what body surface? Dorsal, posterior, anterior, or inferior? Anterior. The belly button is on the front of the abdomen. The shoulder blades are on what body surface? Anterior, posterior, ventral, or superior? Posterior. The scapulae are on the back. The cephalic vein runs along which aspect of the arm? Medial, anterior, lateral, or posterior? Lateral. The cephalic vein is a superficial vein running along the lateral side of the forearm and arm. The ulna is positioned where relative to the radius? Distal, medial, proximal, or lateral? Medial. In the forearm, the ulna is on the pinky side, closer to the body's midline than the radius. To find the femoral artery pulse, you palpate which region relative to the hip bone? Medial, lateral, superior, or inferior? Medial. A femoral artery runs medial to the hip bone in the groin region. The forearm is what to the upper arm? Distal, inferior, proximal, or superior? Distal. The forearm is farther from the shoulder than the upper arm is. The ankle is what to the hip? Distal, superficial, proximal, or deep? Distal. The ankle is farther from the trunk than the hip is. The armpit is what to the elbow? Distal, medial, proximal, or lateral? Proximal. The axilla is closer to the trunk than the elbow is. The chest is what to the shoulder? Medial, inferior, superior, or lateral? Medial. The chest is closer to the body's midline than the shoulder joint. The spleen is positioned where relative to the stomach? Lateral, inferior, medial, or superior? Lateral. The spleen is located to the left of the stomach in the upper abdomen. The liver is positioned where relative to the diaphragm? Anterior, inferior, superior, or posterior? Inferior. The liver sits below the diaphragm muscle in the upper abdomen. The big toe is on the what side of the foot? Medial, dorsal, plantar, or lateral? Medial. The great toe is on the inner side, closer to the other foot. The adductor muscle group is located on which side of the thigh? Anterior, medial, lateral, or posterior? Medial. These muscles are on the inner side of the thigh, closer to the body's midline than the outer thigh muscles. The popliteal artery is positioned where relative to the knee joint? Medial, posterior, lateral, or anterior? Posterior. The popliteal artery runs behind the knee joint in the popliteal fossa. During knee surgery, an anterior approach means the incision is made where relative to the kneecap? Posterior, anterior, medial, or lateral? Anterior. Anterior approach means accessing the knee joint from the front, typically through or beside the patella. The spine is what to the heart? Posterior, anterior, lateral, or medial? Posterior. The vertebral column is behind the heart. The lungs are what to the heart? Superior, inferior, medial, or lateral? Lateral. The lungs are situated on either side of the heart. The occipital lobe of the brain is positioned where relative to the frontal lobe? Superior, inferior, anterior, or posterior? Posterior. The occipital lobe is at the back of the brain, posterior to the frontal lobe. How is the frontal sinus positioned relative to the orbits? Medial, inferior, superior, or lateral? Superior. The frontal sinuses are located in the forehead bone, above the orbits and nasal cavity. What plane divides the body into superior and inferior parts? Oblique, sagittal, frontal, or transverse? Transverse. The transverse plane cuts across, creating top and bottom sections. The great saphenous vein is found where on the leg? Anterior, superior, posterior, or deep? Superior. It is a long, superficial vein just under the skin of the leg. The quadriceps muscles are on the what side of the thigh? Lateral, posterior, medial, or anterior? Anterior. The quadriceps are the large muscle group on the front of the thigh. The hamstring muscles are on the what side of the thigh? Anterior, medial, posterior, or lateral? Posterior. The hamstrings are the muscle group on the back of the thigh. The biceps are on the what side of the humerus? Lateral, posterior, anterior, or medial? Anterior. The biceps brachii muscle is on the front of the upper arm bone. The triceps are on the what side of the humerus? Anterior, posterior, medial, or lateral? Posterior. The triceps brachii muscle is on the back of the upper arm bone. The stomach is what to the pancreas? Anterior, posterior, inferior, or superior? Anterior. The stomach is in front of the pancreas in the abdomen. The liver is what to the stomach? Inferior, posterior, superior, or anterior? Superior. Most of the liver lies above the stomach. The bladder is what to the small intestine? anterior, inferior, posterior, or superior. Inferior. In the pelvis, the bladder is below the loops of the small intestine. Cervical vertebrae are positioned where relative to thoracic vertebrae? Anterior, superior, inferior, or posterior? Superior. Cervical vertebrae are in the neck, above the thoracic vertebrae of the chest. Lumbar vertebrae are positioned where relative to the sacrum, inferior, lateral, superior, or medial. Superior. The lumbar vertebrae form the lower back and are above the sacrum at the base of the spine. The sacrum is positioned where relative to the coccyx? Posterior, inferior, superior, or anterior? Superior. The sacrum is a triangular bone above the coccyx, forming the posterior part of the pelvis. Which term means on the same side? Bilateral, ipsilateral, unilateral, or contralateral? Ipsilateral. Ipsilateral means occurring on the same side of the body. Which term means on the opposite side? Contralateral, unilateral, ipsilateral, or bilateral? Contralateral. Contralateral means occurring on the opposite side of the body. When comparing spinal regions, the thoracic vertebrae are positioned where, relative to both cervical and lumbar vertebrae? Anterior to both, inferior to both, superior to both, or between them? Between them. Thoracic vertebrae are inferior to cervical and superior to lumbar vertebrae. The ears are what to the nose? Medial, posterior, lateral, or anterior? Lateral. The ears are farther from the midline than the nose. The chin is what to the lips? Inferior, superior, posterior, or anterior? Inferior. The chin is below the lips. The forehead is what to the nose? Posterior, superior, anterior, or inferior? Superior. The forehead is above the nose. The thoracic cavity is what to the abdominal cavity? Superior, posterior, inferior, or anterior? Superior. The chest cavity is above the abdominal cavity. The pelvic cavity is what to the abdominal cavity? Anterior, posterior, inferior, or superior? Inferior. The pelvic cavity is below the abdominal cavity. The chin is on what surface of the body? Posterior, anterior, inferior, or superior? Anterior. The chin is on the front of the face. The buttocks are on what surface of the body? Anterior, dorsal, ventral, or posterior? Posterior. The gluteal region is on the back side of the body. During dorsiflexion, the foot moves in which direction relative to the leg? Superior, medial, inferior, or lateral? Superior. Dorsiflexion pulls the toes superiorly toward the knee, decreasing the angle between foot and shin. The talus bone is positioned where, relative to the calcaneus in the foot? Superior, inferior, posterior, or anterior? Superior. The talus sits superior to the calcaneus in the foot. The elbow joint is what to the shoulder joint? Distal, deep, superficial, or proximal? Distal. The elbow is farther from the trunk than the shoulder is. The wrist joint is what to the elbow joint? Proximal, posterior, anterior, or distal? Distal. The wrist is farther from the trunk than the elbow is. The skin is what to the fat layer? Superficial, deep, medial, or lateral? Superficial. The epidermis and dermis are the outermost layers. Muscle tissue is generally what to fat tissue? Lateral, medial, deep, or superficial? Deep. Muscle is typically found beneath the subcutaneous fat layer. The arteries are usually found where relative to veins? Medial, lateral, deeper, or more superficial? Deeper. Arteries are often located deeper for protection, while some veins are superficial. The heart is located within a smaller cavity called what? Pericardial, cranial, pleural, or peritoneal? Pericardial. The pericardial cavity surrounds the heart within the thoracic cavity. The medial bone of the forearm is the radius, humerus, ulna, or carpals. Ulna. The ulna is on the pinky side in anatomical position. The lateral bone of the forearm is the humerus, ulna, radius, or carpals. Radius. The radius is on the thumb side in anatomical position. The sternum is what to the clavicles? Anterior, inferior, superior, or posterior? Inferior. The body of the sternum is below where the clavicles attach. The pelvic bone is what to the femur? Posterior, proximal, distal, or anterior? Proximal. The pelvic bone is closer to the trunk than the thigh bone is. The scapula is what to the rib cage? Superior, anterior, inferior, or posterior? Posterior. The scapula lies on the posterior surface of the rib cage. The trachea is what to the larynx? Anterior, superior, inferior, or posterior? Inferior. The trachea is below the larynx. The pharynx is what to the esophagus? Anterior, superior, posterior, or inferior? Superior. The pharynx is above the esophagus. The navicular bone is positioned where relative to the cuboid bone in the foot, inferior, lateral, medial, or superior? Medial. The navicular is on the medial side of the foot, while the cuboid is on the lateral side. The gallbladder is located on the what surface of the liver? Inferior, medial, lateral, or superior? Inferior. The gallbladder is tucked under the liver's inferior surface. The kidneys are what to the peritoneum? Subperitoneal, infraperitoneal, intraperitoneal, or retroperitoneal? Retroperitoneal. They are located behind the peritoneal lining. The abdominal aorta is what to the vertebral column? Posterior, medial, anterior, or lateral? Anterior. The aorta runs down the front of the spine. The spleen is what to the left kidney? Posterior, inferior, anterior, or superior? Anterior. The spleen is anterior and lateral to the left kidney. The axillary artery runs where relative to the axillary vein? Anterior, superior, inferior, or posterior? Superior. In the armpit, the axillary artery typically lies superior or above the axillary vein. The inguinal ligament is positioned where relative to the femoral artery in the groin? Superior, deep, superficial, or inferior? Superior. The inguinal ligament forms the roof of the femoral canal. The femoral artery passes inferior to it. The femoral artery becomes the popliteal artery as it passes where relative to the knee? Lateral, medial, posterior, or anterior? Posterior. The femoral artery passes through the adductor hiatus and becomes the popliteal artery behind the knee. The anterior tibial artery is positioned where relative to the tibia bone? Lateral, anterior medial, or posterior? Anterior. This artery runs down the front of the leg alongside the tibia. When drawing blood from the median cubital vein, it is found where relative to the elbow joint? Posterior, lateral, anterior, or medial? Anterior. The median cubital vein is a superficial vein in the anterior cubital fossa. The carpal tunnel is located where relative to the carpal bones? Deep, proximal, distal, or superficial? Deep. The carpal tunnel is a passage deep to the flexor retinaculum and carpal bones. The tarsal tunnel is positioned where relative to the medial malleolus? Anterior, inferior, posterior, or superior? Posterior. This tunnel lies posterior to the medial malleolus, transmitting nerves and vessels. The mental foramen is located where relative to the mandibular teeth? Inferior, anterior, superior, or posterior? Inferior. The mental foramen is typically inferior to the mandibular premolar teeth. The otic ganglion is positioned where relative to the mandibular nerve? Superior, inferior, medial, or lateral? Inferior. This parasympathetic ganglion lies just below the foramen ovale, near the mandibular nerve. The orbital floor is positioned where relative to the maxillary sinus, superior, anterior, inferior, or posterior. Superior. The thin orbital floor separates the eye socket from the maxillary sinus. The nasal septum is positioned where relative to the nasal cavities, medial, anterior, lateral, or posterior. Medial. The nasal septum is the midline structure that separates the left and right nasal cavities. The oral cavity is positioned where relative to the nasal cavity, inferior, superior, posterior, or anterior. Inferior. The mouth is below the nasal cavity, separated by the hard palate. The buccal branch of the facial nerve runs where relative to the masseter muscle, inferior, superior, deep, or superficial. Superficial. The buccal branches run superficially over the masseter muscle toward the cheek. In the brain, the cerebral cortex is what to the cerebral white matter, superficial, deep, medial, or lateral. Superficial. The cerebral cortex is the outer gray matter layer, while the white matter forms the deeper internal regions. Within a lymph node, the capsule is what to the germinal centers, superficial, deep, proximal, or distal. Superficial. The fibrous capsule forms the outermost layer, while germinal centers are found deeper within the node. The aorta is what to the pulmonary trunk, right and posterior, left and anterior, medial and superior, or lateral and inferior. Right and posterior. In the heart, the ascending aorta is to the right and slightly behind the pulmonary artery. The apex of the heart points in which direction relative to the base? Anterior and medial, inferior and left, superior and right, or posterior and lateral. Inferior and left. The apex points inferiorly and to the left, while the base is superior and more central. The sigmoid colon is positioned where, relative to the descending colon, inferior, lateral, medial, or superior. Inferior. The sigmoid colon is the S-shaped final part of the colon, inferior to the descending colon. The pylorus of the stomach connects to which part of the duodenum? Superior, inferior, posterior, or anterior. Superior. The pyloric sphincter opens into the superior part of the duodenum. The hepatic flexure of the colon is positioned where relative to the liver? Superior, inferior, medial, or lateral. Inferior. The right colic flexure is inferior to the right lobe of the liver. The fundus of the stomach is positioned where relative to the cardia, lateral, medial, inferior, or superior. Superior. The gastric fundus is the superior, dome-shaped portion above the level of the cardia. The uncinate process of the pancreas extends where relative to the superior mesenteric vessels? Posterior, anterior, inferior, or superior. Posterior. The uncinate process hooks posterior to the superior mesenteric vein and artery. The gastroesophageal junction is positioned where relative to the diaphragm? Posterior, inferior, anterior, or superior. Inferior. The esophagus passes through the diaphragm, with the GE junction located just inferior to it.